Hello, Joe. How are you?
Oh, don't feel great now.
Do you not, Joe?
No, I don't feel good at
My
all.
name's Mary. Okay, I'm going to be one of the nurses looking after you now that you've arrived on the ward. Okay.
No, I don't feel good.
What
Nurse.
way?
I feel I might get sick.
Okay, hold on now, Joe, and I get you a bowl.
God, I might get sick.
Okay.
Oh.
Good man. Now sit up. Okay. Oh, you poor thing. Okay,
God.
take it easy now, Joe. Take it easy.
Oh, I feel terrible.
Okay.
Is that a lot?
That is a lot now. I'm just going
Was
to
it the
go.
blood again?
It
Nurse,
is
was
the
it?
blood again. All right, Joe. I'm going to go now and get the doctor. Okay, Joe.
Okay.
Hello, Emer, can you come with me? How are you? We just have Joe. He came up from ED and he had some hematemesis down there, about 50
Who's
mils,
that?
but he's after. This is the doctor, Joe.
Dr. McMahon, Emer.
Oh, are you an intern?
I am indeed, Joe. I'm going to do my best to look after you. I'm just
Okay.
going to have a chat with Mary. Is that okay? And then we'll speak.
Okay.
Okay, Joe came up and I'm just after doing his observations there. There's his early warning score, but he's just after being sick and it's hematemesis quite a lot.
Okay.
And he
what
only
was
had
the
50
estimations
mils,
in that,
it's
Mary?
about 200.
Is it? Okay.
Yeah.
And did you
so-
mention he had
I
hematemesis?
feel
I'll
like
just
this
pop
is-
Yeah,
on
he had
the
about
glove.
50 mils. Okay, when he was down
50
below in
mils
ED, but
in
that's
ED.
quite
Oh,
a
I
lot.
might be sick again.
Okay.
Okay, hold on
Might
now,
be
Joe.
something on the other side too.
Okay, hold on now,
oh
Joe.
dear.
We'll sort you out, okay?
You're really struggling, Joe, aren't you?
Now,
Okay.
that's it. Good
There we
man.
go.
That's it. Take it easy now.
Oh.
Okay, I've got
That's
that, Mary.
it.
Did you
The
mention?
diarrhea came out as
And he
well.
had some diarrhea
Diarrhea
as
as
well.
well, oh
yeah,
dear.
yeah.
Okay, and was
Yes,
that very
up in the
black,
middle
Mary?
there, yeah.
Oh, it is,
That's
yeah.
it.
Okay, all right.
Okay.
Joe, can I ask you, has this ever happened before?
Oh, it did yeah, about a year ago or so.
About a year ago. And at that time, what happened? Can you tell me?
Oh, sure, much like the same now. It's heavy week on the drink and
Heavy week on the drinking, okay. And you,
the blood as well.
It's just
lot of blood, okay. And did you come in? You came into the hospital. Were you up in intensive care?
I was, yeah.
And did they put a tube down to stop the bleeding?
They did something anyway. I
Okay.
can't really remember.
You got blood at that time, did
I
you?
was given a lot of blood.
A lot of blood.
transfusions and stuff.
Okay, all right. So
Okay.
this time then, Joe, when did the vomiting start?
Yesterday evening.
Yesterday. And did you say that you had a heavy weekend?
Oh, I did a course. I was at a
You
wedding.
oh, right, okay. So the vomiting blood since yesterday evening, again today, and now this third time with a bit of diarrhea there as well.
Yeah, I feel-
Okay.
I feel awful lightheaded now.
All right.
Do you want
Okay.
me
Do
to
you know?
get somebody else for
Yeah.
you?
Would you mind if one of my colleagues is out? I'm just going to
Okay,
open
I've
up these
left the
fluids,
strip
Mary.
chart there, so
Brilliant,
that's
brilliant.
we have.
I'm just going to give you a bit more fluid there, Joe. I see you have a line in. Okay. So
No,
tell me,
fine.
is there anything else I need
How
to know?
are
So
you? Can
you
you come
have the
in here?
difficulty with
Something for
the
help
bleeding.
here?
Are you on any
With,
medications?
Joe, this is Joe.
I gave the nurse the sheet.
You gave the nurse the medications,
Medication,
Mary.
I have
yeah.
them written
Oh,
down
hi,
here
Sharon,
for
how
you.
are
I
you?
really remember.
This is
Yeah.
Joe here. I'm just
Now,
taking a quick
there you
history,
go.
Sharon.
That's his medications, you know, so he's on what?
Yeah.
because
I'll let you look at
Dalfor
those and I'll keep going here. So
Right.
Joe,
That's it,
you
I need
mentioned you
some
had a
bloods done
camera
because
down
he's
into the
after
tummy.
getting sick.
Any
Sure,
other
yeah. He's had
procedures
quite
you've
a
ever
lot
had done,
of,
or do you attend any other
hematemesis.
doctors?
Oh, right. Some Malene as well,
Say that
so
again?
Okay. Do you attend any
That's
other
it. Like,
doctors?
do you want any more
Supposed to go to a
fluids?
liver doctor.
A liver
I
doctor.
I'm not
never
quite sure,
remembered
actually.
to go, to be honest.
I'll just take
Okay,
the bloods
so liver
anyway,
doctor.
yes.
And nothing else you think I need to know about?
Not that I can think of
Not
anyway.
that you can think of. Okay. I might just have a look at your tummy, Joe. Is that okay?
To hand.
Yeah.
Feel awful lightheaded
Okay,
That's
now.
great.
I
Thanks,
know
Mary.
you do, Joe.
Any pain there at all?
No.
Nothing at all?
No.
Any pain here in the middle?
A little bit in the middle.
A little bit in the middle there. Okay. And nothing else?
Just a little bit now.
Okay. All right. And we'll just have a
I feel
little
I'd be sick
listen.
again, nurse.
Sorry,
Oh,
dear.
will I just
Okay.
go ahead and take the bloods?
That'd be
Is that
great,
what you want?
Sharon, if you
Yeah.
don't mind. You might put in a wide spore cannula as well.
Oh yeah, sure, no problem.
Any more fluids up or anything?
Yeah, once Sharon has that. Okay, Joe, you all right there? Once Sharon has
Oh,
that
God, what's
cannula
going
in,
on?
we might hang another bag of fluids. Sharon, would you agree? We might get another bag of heart
Yeah, great.
Just looking at his heart
going
there,
on,
he's
doctor?
very,
Very
very
good.
tacky.
So what's
Yeah,
the
his
story? So what's going on?
So basically, this is Joe. He's a
Now, Joe,
68-year-old
you try and
gentleman who
relax
came
there,
in
good man.
up from A&E just now, basically with vomiting and hematemesis yesterday evening.
Sure.
Again in A&E, and it's had a third episode now. It's
Oh,
about
okay.
200 mils. He's also had some melena there as well, Mary
Okay.
tells me.
feel
Has a
very
history of
lightheaded.
this about a year ago, and it sounds like he had a scope done at that time.
All right.
And also, Joe, you were telling me you attend the liver doctor, so I wondered, does he have some portal hypertension or that going on as well? You've seen the meds there.
Yeah.
So I suppose from now, where
are
we've
you?
fluids, Mary's
Sorry, Joe.
getting
My name is Sharon. I'm one of the
Where's my
doctors
wife?
here, Joe.
Mary's getting some
I'm
fluids
sorry,
there.
Nicholas,
So,
do you know
well,
he's
let's get
getting more tacky,
blood,
will
so
I-
FBCs,
Nurse, can you get me a drink?
SMAC,
I feel awful
group and
thirsty.
hold.
I think a cross
Okay,
match
hold on
actually
now.
with the bleeding that's going
Is
on. We might
there,
cross for 2 units.
cross
and-
for 2 units,
Yeah, we
okay.
might phone the lab about that actually and get
Did you do an
guidance.
EBG?
Yeah, well, that'll give us a quick.
It would
HB.
actually, yeah. Would
Perfect.
you mind
Yeah.
doing that,
No, no
Sharon?
problem at all.
Mary, do you know, I'm new to this hospital. Is there any guidelines
is
for
special guidelines
transfusion?
here, and
Okay, Joe, we're
yeah,
just sorting
we
you
have
out
it in-
now.
Would I get one of the regs? to go?
Perhaps,
Would
yeah.
be no harm,
That'd
because he's
be
getting more tacky
that'd That'd be great. Yeah, yeah. Do you know what, Mary? Actually, will I phone for the reg altogether?
I know, I'll get her.
You're going to go and get her. Okay,
Hello.
that's great.
There's going to be a sharp scratch
I
here now
wonder-
for a minute, okay? So I'm
How
just
are
going to
you?
put on some
The girls
oxygen.
here, Emer and Sharon, there.
Oh, great. I'm just going to put on some oxygen. Joe, just putting on some oxygen as well. Okay.
I've
Emma,
Terry
I'm going to
here.
go off to
Terry, hi.
ABG.
Okay, brilliant. You get the ABG, brilliant. Just some oxygen there, Joe, and we'll have
What's
that up
going
at
on here?
100%. Hi, Terry. Are you the
Hi,
reg?
how are you? Yeah.
Hi, my name's Emer. I'm one of the interns. I'm a bit new, so. But this gentleman is a 68-year-old man who came in through A&E just this evening. He's had 2
Hello, Joe,
episodes
how
of
are you?
hematemesis and an episode of melena as well. Large volume, heavy drinking over the weekend.
Okay.
Becoming quite unstable. I suppose his heart rate has been rising since we've been here. What we've done is, myself and Sharon, the other intern, we've put in the 2 white bore lines. We have fluids going wide open. Sharon has bloods, and we've done a group and cross match for 2 units.
Okay.
And she's gone to speak to the lab.
So we haven't got any blood into him
We
yet?
haven't got
no?
any blood
And how much
yet.
fluid has he had yet?
He has had, so we've just opened the 2 litres here. At this stage, I think he has about 500 mils gone in.
Okay.
Sorry, how you doing? I'm one of the
Yeah,
interns.
he's
How
not,
are you?
you know, he's gone down more. And
Oh, we better tell Terry
Okay,
that.
let's get some O negative. Can you run down to ED and just get whatever they have? And the cross match is sent, isn't it? Yeah, will you ring the lab? And he'll probably need some blood products as well, so they'll be able to tell you in haematology what to
Yeah,
get.
they
If I activate the vasotransfusion.
I think so, yeah,
That's
yeah. I
there,
think
yeah.
we're good.
Great, okay.
is there anything else you want done?
He's not looking great, sure he isn't. I put on
Is
the
that, will you put him on the
oxygen there.
rebreather there, please?
Yeah, I will.
Sorry, just because that's a
Yeah,
venturi there, so we need the proper. Thanks.
His early warning score was only 1 when he arrived up. But
Okay,
now
and
it's
what's
gone
there?
to 5. you know.
Okay, great. And have we haven't contacted anaesthetics or anything because he'd probably
No.
need an ICU bed. Oh look, he's going off there now.
Okay, here's the blood.
You okay, Joe? Are you feeling okay? Can we just attach the leads and everything because he's kind of peri-arrest and
Will I hang on the
actually. Yeah, hang the blood there, please. We'll probably just call an
can you
arrest
call-
altogether,
yeah.
please. Yeah, just because he's kind of
Just
Thanks,
put
sir.
on those.
Sorry,
Just
Joe.
off
We're
the
just going to put on the
rest,
leads to you now. Good
I
man.
wonder, will I take
You
the
feeling
back
okay,
off the
Joe?
bed here? We might lie flat.
Okay.
Okay.
Oh, sorry.
Sorry, Joe. We're just going to lie you down flat in the bed, okay? We might take those pillows out. I wonder will we scoot
careful
them
now.
down a small bit there? Perfect.
Now,
There.
Yeah, sorry. How are you feeling, Joe? Are you okay?
That signal isn't really picking up there.
He's on hand medications. Can I put him
You
on?
okay, Joe? You still with us there? Yeah, okay.
Okay, we'll have to get him ready for theatre because he's obviously still bleeding. What's his tummy like? Did you
His
see?
tummy, his tenderness just in the epigastrium, otherwise soft bowel sounds. Actually, I didn't listen properly for bowel sounds. Will I do?
Great. Okay.
Poor Joe.
yeah. How are you today?
Oh, don't feel great now. I feel a
Do
bit
you
sick
not?
now.
Okay. All right, Joe. Well, look at I'll go get a bowl for you. All right.
Oh, I don't feel. Oh God, gonna be sick, mate.
All right. Hold on now, Joe. Good man. Okay. Take it easy. That's it. Good man. Good man. That's it. Okay. Oh, you poor thing.
Oh God,
Okay. You really, God, you have had a good.
terrible now.
All right.
You
Okay.
should not all those beers over the weekend.
Oh, were you drinking heavy over the weekend,
was,
Joe?
a big
Oh, well, listen here now. You have a good lot of blood here in this dish, so I'm just going to
Is
go
that
and
what
get the
it is, yeah?
doctor. Yeah, I'm just going to go and get the doctor for you. Okay.
Oh, okay.
Good man. Hello, Emer. How are you?
How are you?
I am fine. I have just received Joe up from ED,
Hi, Joe.
and he's a 50-year-old man in with hematemesis, and he's after having some. He only had 250 mils,
Okay.
and this is about 200 mils now, roughly. just
250
now.
and 200 now. Hi,
Yeah.
Joe. You're not doing too good. You're vomiting up this, but okay.
Observations. His early warning score was
I
only 1 and
see
it's gone
that.
to
Oh, I
5.
feel I might
Okay.
get sick again now.
So, okay,
Okay,
hold on
Joe,
now,
yeah.
Joe.
Oh, doctor, help.
You're all right, Joe. Yeah.
Okay,
Mary
now-
has it sorted there. I'll hold that for you there. Oh, good man.
That's it. Good man, Joe.
Okay. Oh dear. There we go now.
More of the blood again.
Yeah, a small bit
Little
more.
small
All right,
bit,
Joe.
Not as much now. Not as much.
Joe,
Okay,
can
good
you
man.
tell me?
Oh, I think there could be someone coming out the other side now.
Oh, really?
God.
Yeah, that sometimes happens, Joe.
We'll sort
that
you out. Now,
out.
Joe.
Joe, can you tell me a little bit about what happened before you came into hospital?
Oh, well, sure, I was drinking over the weekend and I just yesterday evening there I got
Sorry, Emma,
started
yeah.
puking up blood.
Okay, yes, Melina. So you vomited up some blood yesterday evening,
I
yeah?
did, yeah.
And then this evening you came into the hospital, vomited more blood, and again now.
Yeah.
And some of that diarrhea there, that nasty stuff as well.
Oh, I don't know.
Okay. And can you tell me prior to that, did you have any pain in the tummy or no pain at all? And what had you been?
A tiny little bit on the high up.
Tiny little bit high up in the tummy.
A little bit ulcery.
Okay. Little bit ulcery. Do you have ulcers, Joe? Do you mind if I'll just pull the blankets back there and we'll have a look at them?
So the doctor used to tell me I have them anyway.
The doctor used to tell you. So do you attend a doctor about your tummy?
I should be going to a liver doctor, but
Should you?
I always forget.
And is there a problem with the liver?
Oh, I'd say so at this stage.
Really? Okay. All right.
I was in last year now, something similar to this as well.
Okay.
Do you want me to? What do you want me to do for you?
I wonder, one of my colleagues was out at the desk outside. Sharon,
me
would
to
you
get
mind getting her?
her?
Yeah, she's
Yeah.
the heart rate's going quite fast. So Joe, I'm just
She's-
putting a
yeah.
hand on your tummy here. Have you any pain there? Is that sore?
Hello, Emma
Little bit
would like
sore
you to
there.
give her a hand with
Okay, and I
Joe.
don't
He's
see any
just up
scars
from
there. You've
ED.
never had any
50-year-old
operations.
man with
Did you ever have this
hematomas.
before,
And as you
Joe?
can see, he's had quite a
Yeah,
lot,
this
and he's
is
had
last
some
year.
malignant
Last
now
year.
as well.
Okay.
Same
those
thing.
are
Okay, and you
his
came into
tablets.
hospital. Were you unwell at the time? Were you in
Just
intensive
examining
care?
him
Or?
now.
Sure.
Hi, Sharon. I'll be with you in a moment. So tell me, were you in intensive care that time? You were. Okay. And did you have a procedure done?
Sick again, doctor.
Oh, really? Mary, I might get you to get that. Sharon, hi. Yeah, this is Joe.
Sorry now, Joe.
He
Just
is
take
in
it
with
easy,
2
good
episodes. He's a
man.
45-year-old
Deep
gentleman
breaths.
in with a couple of episodes of
Okay,
hematemesis
good man.
and some melena as
Good
well.
man.
He's going
How are you
quite tacky.
feeling?
Would you be able to get a line and
Sure.
some bloods off? And
Yeah,
just
yeah.
with the
He's
amount of
not-
bleeding.
Yeah, I think now, girls,
Yeah.
we need some more. He's
We
going,
do, yeah.
His pulse is much more tactic than what it was.
He-
Will I get
he is.
somebody else for you?
Would you mind seeing if we could call for the reg? Actually, that'd be great. Sharon's just going to get a line
Okay.
and some
Yeah.
bloods.
I
We
think
might
I
get.
saw her out in the corridor here
That'd be
when I was
great,
going.
yeah.
Yeah,
We
the
might
right
get
doctor,
a
if you
group
like.
and
Oh,
hold,
okay.
or rather group and cross match, Sharon.
Group and cross match.
Yeah,
Oh, yeah.
for at least 2 units.
Oh, yeah.
In here.
I wonder, would we get? I wonder, I might get an
Joe, a
ABG as
50-year-old
well
up
while
from
we're
ED,
here.
we
Done
can
ABG,
have
yeah.
his-
Yeah.
He's after having some melina.
Come on, doctor.
And
We're just giving you some fluids. No, this is one of the senior doctors, Joe. Is just going to give us a hand. Yeah.
Joe, you're just going to feel a sharp scratch now. I just want to do a blood
Hi,
test.
Terry. How are you?
Hi, Terry.
My name's Emer. I'm one of the interns. This is Sharon, another intern. So this is Joe. He's a 40-year-old gentleman in with now 3
Joe,
episodes of
sharp
hematemesis,
scratch now,
and he's
okay?
also
Just
had
want
some
to take
melena
some
just
blood.
now
Is
as
that
well.
okay?
He's becoming quite unstable. We're just getting another line
That's
here.
it.
He's
Well
one line
done.
in. I've opened up those
Nice
fluids
deep
running
breaths
in.
for me. I'll just put in
Sharon's
manual
going to take a
now,
group
so
and
that-
cross match.
Have we ordered any own egg?
We haven't yet.
I might crack on with some own eggs.
Will we? Would you like me to go and get that, Terry?
Yeah,
I was
if you
just going to.
wouldn't
Will
mind,
I'll
that'd be
take this
great. Sure, that's
ABG
great.
and then I'll go and get that. Is that
Send the
okay?
blood off to the lab. Is that all right? That's
perfect.
Just try. I'm just
So
putting up
how
some
much
more
fluid
fluids
do you have?
there now
This is
when
the second
you're
one.
I've just
okay.
put in the
Yeah.
cannula, so
Yeah.
that 1 litre gone in each side.
We have
so
our.
Can you go and get the own egg so while you're
Sure.
doing that
Sure,
ABG?
yeah. Fusion
Emer-
management.
Oh, thanks very much.
Okay.
Sharon has gone to get
The
own
own
egg.
egg. Brilliant. That's great.
So, and how many units
Do you
have
want
we
me to
cross
go with
matched in
that?
for?
Emer, are
Just
you
for
okay?
2, but I was going to phone
Can
the
we put some
lab.
oxygen on him actually? He's got no oxygen
Yeah.
on his shoulder. Will you put on 100% non-rebreather?
I'll just send this ABG to the lab.
He's getting quite.
Have we a
his
pressure
pulse
bag
feels
as well
Get the
there, Mary,
ABG
actually?
back there.
just all tangled up here. I'm afraid.
Thank you.
Is there a pressure bag around?
Pressure goes.
Terry, that's his ABG. I'm just looking. His HB is only
Terry,
6.
will I hang the
Hang that straight away, and will you actually ring the lab and tell them that we need 6 units there?
Would you like me to do
6
that?
units.
They'll need the lab and they'll need whatever product
He
they
has.
have as well.
He has
No
the
problem.
last 10 years.
No
the
problem.
last prize.
Have we catheter in?
No.
Okay, can we get a catheter in?
Sure,
if we have
yeah,
time
yeah.
there, yeah, please. Brilliant. That's great. How are you feeling, Joe? Are you okay? I think we'll need to bring him
That's
to
up.
theatre now because his blood pressure's
He's going
very
up.
low
He's going
there,
very
yeah.
tactic.
Hi,
He's
I'm
gone
looking to
up.
go through to the haematology lab, please.
Do you want me to do the catheter here?
Yeah.
Thank you.
Yeah.
Please.
So once Emer's off, we might just get anaesthetics down. We're going to need to bring him to theatre, so
Joe.
I'll ring
Okay.
theatre now and get
Joe.
Okay.
that organised.
Grand. I'm just waiting for the
Joe,
lab to
can
phone
you
me
hear me,
back
Joe?
there.
Okay, great.
Joe,
So we
I'm
have
just
fluids
gonna
going
do.
in, we have oxygen, we're getting the catheter.
Not really responding to you there, but I'll just do the
Girls,
catheter anyway.
do you see his he's going? He's
Heart
going
rate's
up.
a bit high.
Okay, let's put him on the leads here because just I'm a bit worried.
I'll
about
ring
the heart rate
anaesthetics.
now. Yeah, do please. Thanks, brilliant.
Joe.
Joe, I'm just going to
But
put
I
on
still do the
the.
catheter.
You okay, Joe? Joe, I'm just going to put some leads on.
put it
Just
on
keep
it.
an eye on
One
your
of these.
heart.
Size
Sterile
you want?
field. 16, please.
Hi, Switch. Could you have anaesthetics on call to give me a ring back here, please, urgently?
Joe.
I'm here in A&E with the with
man.
the
Okay,
nieces
Joe, good
in
man.
A&E. Thanks. Cheers. Terry, with this kind of a patient, is it surgeons or is it gastro? I'm
We'll
not
bring him
sure.
up to endoscopy now.
Endoscopy. Would you like me to ring the gastroenterology reg?
Okay, Okay, so this is the gentleman who came in with respiratory tract infection, he had no known allergies, had a second dose of coamoxiclav 1.2 grams IV and developed anaphylactic shock. So far he has had his first dose of adrenaline, he's had 1 dose of hydrocortisone 100 milligrams.
Okay.
Back on the chest. Back on the chest.
So Mary, as a nurse, how do you think that went, that scenario?
Well, for me, from a nursing perspective, I think it went very well. Well, I suppose I was very much in control because I knew the patient. And Emer, I was kind of, I was trying to prompt her a little bit. And, and asking her, the various things like, just trying to let little things out that maybe she'd pick up on. But eventually she did. But she was new. I kind of, the way, and I suppose for an intern, we tend to take over that little bit when you're on the ward, when the intern is new to the area, I suppose, and because we know the patient so well. But from my point of view, I think it went very well.
So she said, so you called her and then she came and she wasn't really sure what she was supposed to be doing.
Yeah.
What do you think about that? Why did you call her, I suppose, and what do you think about her not knowing?
Well, you see, I was worried about him because he was getting short of breath. For a fit man, he was 45, the way he was very fit. And I wanted her down to, to assess him and to do a physical exam on him. But I kind of felt that she was saying, before she had even examined him, she had said put on the oxygen first, the way. So then I had to think, well, if she's going talking to him now, I can't put a mask on him, so I have to put the nasal prongs on, the way. So it was just to, just those areas.
Is it tricky for the nurse to allow the intern to do what they want to do, but really you know what you want them to do? Is that a difficult...
No, it's not. I have to say, with some of the interns, well, majority, they're very, very good. And they will always listen to the nurse and, follow their lead.
Okay.
Follow their lead, yeah.
I got the impression from the intern during her debrief she was slightly intimidated by you.
Well, I didn't. I was trying to help her, not intimidate her. And I suppose, you see, we'd be so used to kind of being with the patient, and if interns are new and new to the area, and if we know our patients really well, then we know, how, if they get very sick, we try and guide them. It's trying to guide them, but maybe Emer didn't see it like that.
Okay. When you did the handover to Sharon when she came in, well, Emer did the handover, but you were quite involved in that handover.
Yeah, well, I suppose I was trying to get the point across that it was only since I put the drug up that he began to get very, very short of breath. And I think, initially Emer wasn't, in tune with that. So I was trying to get that point across.
Okay, so it was important then, really. And then once Sharon came in and once the patient had the reaction started to go downhill, how do you think the team worked together?
I think Emer got a little bit lost. Sharon came in and Sharon took over, and I think I said to Sharon, I said, was the arrest team called? And Sharon said, yeah, it was, Emer called it, so, because I was waiting for anaesthetics or, whatever to come. I didn't say arrest team, I think it was anaesthetics, I said, or anaesthetics coming. So, kind of thought I was expecting more people to come into the...
So were you confident that the arrest team had been called?
Yeah.
Okay, as far as you're concerned, they were?
Right, yeah.
Yeah, okay. Could you have done anything, and what were you doing during this period of high...
I was doing the compressions, but I felt like, say, maybe if Emer had stood and done the compressions, that maybe I could have gone to the phone then and called the arrest team and, have been setting up, getting the drugs ready.
So do you think as a resource, perhaps you had more expertise and experience, that you could have been doing more than the compressions?
Yeah.
Okay.
Yeah.
Is there anything you can take away from that scenario?
No, I think probably if Emer felt intimidated by me, maybe it's not to kind of, for interns to feel like that, when they come to the ward area, and that, to have better communication and, to work kind of alongside each other.
I think it was difficult. I think there were elements of good and bad. I think as soon as I came into the situation, we were very much in the thick of it. Things had gotten very serious very quickly, which does happen with anaphylaxis. Things go off very, very quickly. But from that point of view, I was trying to play catch up on what had happened and deal with the immediate situation at the same time.
Was there time to catch up? Did you feel it in the scenario? There was, once you dealt with the immediate situation, was there ever a time where you were able to catch up?
Well, I suppose the immediate situation hadn't come to fruition at that time. At the time, the intern was just, confused and didn't know where to go from here. The patient was going off, but she was talking to me about an infection or, potentially presenting it as an infection point of view. So I was trying to take her history. I was trying to quickly look through the notes and then go up and examine him myself, all at the same time. And the first time I glanced at his vital signs, things were somewhat okay. I think his stats were about 90. I was like, okay, we pop him on some oxygen. And then at the same time, suddenly he became, really, really unwell. And I was trying to recap on everything that Emer had told me. I was trying to see, did I see anything in his notes? And Mary at the same time was saying, I've just given him his coamoxiclav. And I was kind of trying to put the pieces together, but on the background going, is this just him being sick from a respiratory tract infection? But then the rash came through. And I mean, once the rash comes through, I had rash, I had more signs for anaphylaxis. And I was quite confident that whether it was or wasn't anaphylaxis, I certainly had to consider treating it.
Okay. And was the intern a good resource to you?
From a information point of view?
From a point of view of helping with this management of the patient?
Yeah, I think she was. I do think she was, especially in drawing up medications or getting things. So as soon as he became acutely unwell, the oxygen went on, then I wasn't happy with his blood pressure, or that I felt that this was anaphylaxis, and I asked her immediately to drop the drugs. I gave her clear instruction what I wanted, which drug I wanted, and what I wanted, and it was drawn up and ready to give. So from a practical point of view, because I was still trying to now examine him and then had to think about calling anaesthetics because this was going to get very serious very fast. So I felt I gave her clear instruction and that the medication was given.
And so would you use, because she was junior and inexperienced, would you give more clear instructions perhaps than you would to a more senior person?
I would. I think there's an element of assumption when we're dealing with, if I'm dealing with somebody more senior to me or if I'm dealing with somebody along the same lines as me, I think we assume a lot of things and we're both on the same lines. And when it's somebody more junior, when it's somebody in their first week of work, you're saying, did you draw that up? Can you do that please? And, come back to me when that's done, I'm going to give you your next job.
Do you think you could do that to a more senior? Is that a good strategy even with more experienced people?
Not in asking somebody to do something, but I do think maybe if it was somebody of my same rank or higher, that maybe I should be clarifying, I think it's anaphylaxis, do you think it's anaphylaxis, or do you think it's something else? It's not something that's done that often on the wards, but I think it would be good protocol for us to verbalise what we're both thinking and to both come to the same management.
Were you confident when the patient arrested that the arrest had been called?
I believe I asked, was the arrest called? However, as kind of registrar in the room, I did not say to somebody, can you call an arrest? I got preoccupied immediately with, this gentleman is arrested, he's an anaphylactic, so he's always going to be a difficult airway, I need to get some airway management now. And that was my main concern. I think I presumed somebody would call an arrest as I would on the ward, but I would say that it is something that needs to be verbalised. I did ask to confirm that an arrest call had been made, because I'd heard the intern on the telephone, and I was told that there was an arrest call made.
There was some confusion around adrenaline and the route of delivery.
Yes.
To discuss.
Could discuss that.
What happened there?
So at the time, I had come off the phone to the anaesthetics, and the patient had already had their first dose of adrenaline. I was conscious that they may need a second dose. Their vitals had started to go off even further, and that they may need a second dose. I was confident that hydrocortisone had been given, so at this stage I wanted the second dose drawn up and ready to go. At this stage, the patient hadn't arrested, and that was my next line of action. That's what I was going to do. Then when he arrested, I got preoccupied, like I said, with the airway. We had somebody on the chest, and I was now trying to manage an arrest situation, and the intern comes back and they're ready to give the medication that I had asked them to draw up. They had never said to me, will I not draw that up now? Or, things had changed. I presume this is her drawing it up back. So my presumption was that it was the IM dose in the vial that she had, and that she had gone towards her IV line. At this stage, because it was only cycle 2 of our chest compressions, I hadn't yet asked for the drugs to be drawn up, or I hadn't seen anybody go and draw up the IV drugs for the adrenaline for the ACLS protocol. So my presumption was that she had the IM drugs. She and herself, I think, felt, oh, this is ACLS, and had the knowledge to go ahead and draw up the drugs without it being verbalised. So the communication there was quite poor. I think she had gone on to potentially get the IV dose and was ready for it after the 3rd minute to give the adrenaline dose, and I thought she still had the IM dose. And it took, rather than clarifying that, I just told her to stop with the IM dose, or to give the dose that she had IM. One, I didn't clarify what dose she had in her hand. I just presumed it was the dose that I had asked her to make up. And second of all, if I was doubting, I should have asked her what was she thinking or where she was coming from with that, just in case I was wrong.
Could that have been, how might you address that looking back on it?
Looking back on it, when I saw
confusion and the assumption,
yeah,
how could you?
so when I saw her come near the patient, I could have said, Emer, is that the IM dose I had initially asked you to drop, or is this the IV dose that we're going to give in a minute and a half's time when it is protocol to give it, the IV dose? And then she would have said, no, this is the IM dose that I had drawn up earlier, in which case I should have said, that goes, IM. Or else I could have said, can you leave that aside for now? Can you start to draw up the IV adrenaline? We're on the ACLS protocol, and after the next cycle, we'll be giving it. I didn't do that.
I mean, I think some of the difficulty might have been you were busy, overloaded, running, thinking. You had a lot. You're taking a lot on yourself.
Well, at that time, yeah, we were only 3 people running it, so an airway was the main cause of concern because of his angioedema and his swelling. So that was my main concern. But at the same time, as running a scenario, you need to be able to run all elements of the scenario. And as soon as somebody else comes in, let them take over the airway, and you continue to run it from an observatory point of view.
Okay. What could you take from that scenario into your real work?
Into my real work from that scenario, definitely when it comes to the ACLS protocol, when anybody's approaching somebody with the drug, not to assume that she's just doing, because she was a week 1 intern, she's just doing what I last told her to do, to maybe ask her where was she coming from, had she the knowledge, had she thought to get the ACLS protocol. So basically ask her what was the drug, why was her intention of giving it, and then maybe that would have meant that she was just actually really eager and really prepared and ready for when it was. So we could have just continued on the protocol rather than me telling her to give an IM dose. And
do you think confusion around drugs, dosage, delivery, do you think that occurs in the real hospital?
It can happen. It's, to be honest, at this stage it's kind of rare for it to happen in ACLS because it's so drummed into us. The protocol, we get on the chest, you've checked a pulse, you get on the chest and you're doing your airway and then you're getting your drugs. I suppose because we've all had that training, it was not unusual for Emer to have had the drugs drawn up. Rather than me waiting for me to ask her to do it, because we all have that before we start. But I do think communication or looped communication or verifying this is what I have, this is the drug I have, are you happy that this is the drug that I'm about to give, would certainly help to omit any errors.
I suppose I didn't feel it went well from my perspective. I wasn't very confident about what I was doing. I don't think.
The whole thing, or?
In general, I suppose I came in and obviously Mary's a very senior nurse and she clearly had the situation under control, and I suppose I came in, I was trying to make an assessment of what was going on, but before I got to really do that, the gentleman became quite unwell, and I suppose I just rang my reg and then I just started doing what I was told, but I didn't feel I had an overall handle on what was happening.
Is there anything wrong with relying on the more senior nurse, given that she's been around longer?
No, not at all, but I suppose, I felt I had been called in to assess the situation, but I don't feel that that's what I was doing. I felt like she had the situation under control and I wasn't sure what my role was initially. And then as things started to deteriorate, I suppose it became very clear we needed a more senior person than me. And so again, I was sort of doing what I was told, but I wasn't sure that I got a handle on what exactly was happening.
Could you have clarified, if you were confused about your role, could you have clarified it earlier?
I suppose I could have, yeah.
Okay.
I think the situation progressed though, and then it wasn't a situation that an intern could be handling, and so it moved on.
So what made you decide it was time to call the reg?
The patient became very tachycardic. Mary was talking about an early warning score rising. He was deteriorating visibly in front of us. He started developing this rash, and as I said, I was not in control of the situation, and that alone required a more senior presence than me.
And what did you think was going on at that time?
I suppose we were looking at, he was in with his pneumonia. I couldn't add up for myself why he would suddenly start deteriorating. Having been in hospital, he'd commenced treatment, he had been fine. And in listening to his chest, he had sort of reduced air entry. It was difficult to, there was a bit of a wheeze, but there was nothing spectacular jumping out determining a diagnosis. And what I could see on the x-ray, he was already being treated for, so I was a bit at a loss as to what to do next. Until the situation started to progress, he became more unwell. Like I say, Mary flagged the early warning score, and that necessitated senior help straight away, so we went ahead and did that. So from that perspective, I think the gentleman received the appropriate care, but I think it was more to do with Mary than it was to do with me.
Okay. And is that similar to what you might see in the real hospital? In terms
Yeah, I think as a very junior intern in your first week, I think it's very appropriate that a senior nurse is, you know, helping you and assisting, and most importantly ensuring that the patient receives the appropriate care.
And how did the handover go with Sharon, the reg?
Again, I felt that my role was sort of disappeared in that. I mean, when Sharon came in, I initially felt that I was going to give her the handover, but Mary straight away started into the handover. And then I suppose I thought to myself, not out loud, and perhaps I should have said so out loud, but I thought, well, Mary knows this chap. She's been looking after him. She was completely au fait with what had happened. There wasn't any extra information that I had at that time. I suppose I did once or twice, I think, try to sort of interrupt, if you like, to give Sharon the clinical findings on the chest exam, which I suppose I had that Mary didn't. But in doing that, the patient started to develop a very florid rash, and I suppose, again, things moved on. We were looking at anaesthetics at that stage, and Sharon had taken over. It was quite clear at that stage that he was having a severe allergic reaction at the very least, and likely an anaphylaxis. So my information was, at that point, irrelevant.
Did anyone say anaphylaxis to you? Do you think it needed to be said? Was it clear?
I'm pretty sure that Sharon, when she came in, said it. I couldn't swear to that, but I'm pretty sure that that's what she said, that this looks like. And she stopped the, herself and Mary sort of stopped the drug going in, and then initiated the protocol for treatment of that. So we very quickly gave the IM adrenaline and the IV hydrocortisone. Like I say, I didn't have a huge role in that, you know, and then we were waiting for the drugs to take effect, and in that time he deteriorated, and I phoned anaesthetics.
Okay.
Or at least I took a call from anaesthetics. At that point it had deteriorated into an arrest, and I said to them that they needed to come straight away.
Do you think it was enough to tell the anaesthetic nurse that you didn't officially call the arrest guys? Do you think it was enough to tell the nurse you're talking to that that was an arrest?
I can't quite remember whether we called the arrest or not. I don't know if we did. I can't remember. I
Okay.
certainly didn't.
So you told the nurse, the anaesthetic nurse,
I told the nurse on the phone that we now had an arrest situation, but I certainly didn't make a call to call an arrest.
Okay.
I don't know whether or not Mary or Sharon did. I know Sharon didn't, but Mary may have. I'm not sure.
Okay. Confusion around the adrenaline and the route of delivery, so whether it should be IM or IV. Do you want to talk about that a little bit and what you thought?
So prior to the arrest occurring, we were treating anaphylaxis, the treatment of which would be IM adrenaline along with IV hydrocortisone. We had done that, and as part of being prepared for the ongoing situation, Sharon had asked me as the intern to draw up a second, or prepare a second IM injection. So I had done that. Then when he arrested, Sharon said to me, give the next adrenaline. And I suppose because of the arrest situation, I thought I should be giving IV adrenaline. And I brought over, I went to give it IV, and Sharon stopped me correctly because she was concerned that I might be trying to give an IM dose IV, and said, you're giving that IM or something like that. And I said, oh, should I not be giving it IV or something to that effect? And she said no. And I suppose I was querying, what I was thinking to myself was the man had arrested, so we should be going with the arrest protocol, which would be IV adrenaline. Whereas obviously the reg was saying, well, no, we're treating anaphylaxis. I probably could have questioned that further, but I suppose as the intern on day 3 or 4, whatever I was, I felt I should defer to the seniority of the registrar, and it seemed to me that she was in control. She knew what she was doing. She was quite clear she wanted it.
Do you think sometimes senior people are incorrect? Should you have a questioning attitude, and was that the time to question?
Looking back on it, it may have been. However,
it wasn't a case of I knew that this was the right thing to do, and I knew I should. To be honest, I didn't know, so I was taking senior advice on it, I suppose. I wasn't certain that that was the right thing to do, and I think Sharon knew that as well. So I think had I been clearer in my own head that it was absolutely right that I should be going with the rest protocol, I should have said so.
Okay.
The problem was I wasn't, so I didn't know.
And what learning do you think there's learning that can be taken from this scenario into the real world?
Definitely, I think for me as the intern, being aware that the situation changes so quickly, that you know, while you might start off treating one thing, you are now treating another, and being able to shift over into that treatment model is important. I think I possibly could have been a bit more effective as a team member. You know, I was kind of wandering a bit at one point and waiting to be told what to do. That probably reflects the reality of being an intern, however. So, you know, in terms of learning, could I take from it? Definitely the point around the IM versus IV. There was no reason why I couldn't have said straight out, I'm not sure, I don't know, do we not go to the arrest protocol, rather than standing there saying, do I not give it IV? At least it would have made it clearer to Sharon why I was questioning what I was questioning. Whereas she obviously felt, well, I just didn't know, I was the intern, I didn't know. So I should have made that clearer if I had a concern.